Good afternoon, everyone. Thanks for joining us on the news briefing for this Wednesday. Our first topic is COVID-19 information, and we have Dr. Moreno with us today. For those of you with questions for Dr. Moreno, go ahead and put them in the chat. Good morning, Dr. Moreno, or good afternoon.
Yes, good afternoon, ma'am.
So I'm going to give our folks who have questions for you a moment to put any questions in chat that they may have. Are there any questions for Dr. Moreno for COVID-19? I am not seeing any questions, although I do see one of our usual askers on the call. I'm going to go ahead and move on to our next topic, Dr. Moreno. Perhaps there's some technical problem here. If I get questions for you, I will forward them to you. Thanks very much for being with us today.
Certainly. So long.
All right, so for our next topic, for the remainder of the time, we are going to focus on the results of the recent Community Health Needs Assessment. You very likely saw promotions for this important topic, and there was a survey, and I hope you all took an opportunity to take the time and take the survey. The project is a very important part of understanding the health needs in our community, and we have some speakers here to speak to the results, which are very exciting. And let me introduce them to you before each of them speaks on their own. We have Joe Cafaro, who is the Regional Vice President of Hospital Council of Northern and Central California. Krista Hani, Dr. Krista Hani with Planning, Evaluation, and Policy with our Monterey County Health Department. We have Monica Macias. She is a bilingual survey participant. She is also a participant in a diabetes program and can talk more about that. And then we also have our friend Katie Castagna with the United Way of Monterey County to talk about the broad range of issues related to this topic. So we're going to start first with Joe. Good afternoon, Joe. Welcome to the news briefing.
Thank you. Good afternoon. So happy to be here.
I'm hoping you can describe more about the assessment and why it's done.
Yeah, so the Community Health Needs Assessment is actually an assessment that all hospitals that are nonprofit hospitals need to conduct. And they do this for their nonprofit status. Not only is it just to keep an eye and the health of our community and how we serve the individuals that we serve within their service areas, but it's so important, to keep in touch with what are the needs, the health needs, and how is it that we're able to help them and keep them outside of the hospital where they need to be in the community.
Thanks very much for that overview. And so beyond that, so we know why we do it, but now let's talk about what we got from the assessment. And for that, we turn to Dr. Hani, Krista Hani from the Health Department. Good afternoon, Krista. Can you share some of the details and the results that we have?
I will, Maya. Just 1 second. I always have to juggle 3 screens and to make sure I can share it so you can see it. So let me share my screen. All right. Are you able to see my slideshow?
I am seeing it.
Great. So I'm going to go back 1 slide too, but anyways, I always have, all right. There we go. So thank you everyone who's here and for waiting for me to get through my technical difficulties. So we have today the launch of the results of the 2022 Monterey County Community Health Needs Assessment. So as Joe detailed, we have a variety of partners, and many of us, we all came together during and worked closely during the pandemic to provide our community with education resources, vaccine clinics, testing, and more. And that collaboration led us to continue a conversation that started several years ago about how we could align the need to do community health needs assessments across all of the organizations so that we actually could do them all together, combining our resources and our efforts for that. And timing was right this year for all of us to finally do that assessment as one assessment, leveraging our resources to meet the common goal. And so, as Joe mentioned, we really do have that interest in how we can work strategically together to address community health, how we can, when we're asking the community for input, we're not doing it multiple times. So it's a better use of community time as well to identify the trends and the major health issues. And that we do work and have some important projects individually, but then also many of us participating in various collective impact initiatives that can really enhance and create that synergistic work to truly start to move the needle on some health issues. So as I said, this has been going on for actually several years, but in the last several months, we began to form our collaborative back in September, and we actually did an RFP and worked with the Hospital Association as well on that RFP. And we selected professional research consultants, which have worked on community health assessments locally before. They know our community. They've also done community health assessments across the country, very similar to this, where it combines the efforts across hospital and healthcare systems. So we did launch a survey for 300 key informants from multiple sectors and partners in March and May. We also launched a community-wide survey. This was done in a sampling strategy by PRC to be representative of the county. Also, we offered it out online, and we had a really robust response of over 3,000 surveys through telephone and online survey responses. And then in September, we came back together, invited all those community leaders and community members that had been part of the key informant and went even a bit beyond, and had about 136 people that came together on a virtual meeting and helped prioritize the health issues that had been identified with all that secondary and primary data collection and analysis by PRC. And that prioritization process led us to our top 11 and the top 4. Actually, I'll highlight some of the data from today that are all in our community health needs assessment. We actually have a lot of indicators in the community health needs assessment, really over 120, depending on how you slice and dice it, many more. And across sort of what I just have been terming domains that relate to health and wellness, reproductive health, social determinants of health, health status, death, disease and chronic conditions, access to healthcare, et cetera. And then as much as possible, where it was available in the data, to stratify it, to really get down into a little more detail. We definitely wanted to show by region, which we've done in our health profiles before. Each of the hospitals also are getting their report to show the data by their service area, and then also by other sociodemographic indicators such as age, gender, race, ethnicity, income levels, and sexual orientation. And so just briefly, here are the regions. You've seen these before. They're based on zip codes, and we have the yellows, North County, green is Salinas generally, Peninsula Big Sur in the purple, and the orange being South County. And what were the key issues? So as I said, following the September meeting, we incorporated their input to come up with the top issues ranked from 1 through 11, and the top 4, diabetes, mental health, access to healthcare services, nutrition, physical activity, and weight, are all the top 4 that I'll just mention today, going through some of the data that we have. There's several indicators for each of these. I'm only going to call out a few just for the sake of time. Also, though, notice that there was an increased need for social resources such as housing came up. And then in addition, the report does provide the data by those sociodemographic and geographic information, and also some resource supports at the end of the report. So let's start with access to healthcare. And just before I get into that, because this is a great overall indicator, that you can use sort of to track progress in the broader context across a variety of indicators. So in our survey, 18.8% of the survey respondents reported experiencing fair or poor overall health. And the percentages were higher in South County and Salinas. And then also just keep in mind that although some of the geographies are higher, like here, even within those geographies and what you may see in some of the individual hospital reports where there's a bit more drill down by city, that there could be also some higher percentages or pockets. And that just allows us to also identify areas to really target some strategies and resources going forward and collectively to try to improve overall how people rate their overall health. So I'll start with diabetes. And the prevalence of diabetes in the county is 10.4% compared to 9.8% in California. And within the county, the prevalence is highest overall in Salinas at 14.9%. And then when we're looking at sociodemographics, you can see the primary correlation is with age, where 20% of Monterey County adults age 65 and older have been diagnosed with diabetes. And not shown here, but in addition, another 15.3% of county adults have been diagnosed with pre-diabetes or borderline diabetes, which is a great opportunity to really get people engaged with prevention programs. For the mental health indicators, we can see that, again, the prevalence of those who say they experience fair or poor mental health is almost 3 times higher locally than in the US. And by region, highest in North County. And we can also see higher prevalences for those having ever been diagnosed with a depressive disorder or experiencing symptoms of chronic depression in our county compared to the benchmarks. And again, higher prevalences were in Monterey Peninsula and North County, respectively, for having been diagnosed with the depressive disorder and experiencing the chronic depression. It's in the report. I'm just not showing it on this slide right now. And then looking at some of the sociodemographics, we can see higher rates for those experiencing symptoms of chronic depression for those 18 to 39 years of age, very low and low income, Hispanic, and the LGBTQ plus populations in our county. So really great to have that ability to look and stratify by those different areas. And then we're going to go on to access to care, access to health care. So overall, 8.4% of Monterey County residents lack healthcare insurance coverage, and the rates are higher in young adults, though, 18 to 39, an area for opportunity in the county. And for residents below 200% of the federal poverty level, also a potential opportunity with Medi-Cal expansion. Also for Hispanic persons and Asian persons. And then the barriers to access that prevented getting medical care in the past year or from include from getting an appointment to the language spoken are also higher in Monterey County across the regions compared to the US overall. And then these needs were really high throughout the county. So you could see for the difficulty finding a doctor, that was highest in the peninsula. For lack of transportation was highest in South County. Language, cultural barriers were highest in Salinas, and the rest were highest in North County. So again, as we work together, we can think about how we're developing strategies specific within populations and communities in the county. Notably, higher percentage of our residents in the US population do not have cash on hand to cover a $400 emergency expense. Now, this is getting more into the financial side of things, but of course that does relate to when you're trying to make decisions as it relates to your access to care, as you're dealing with other emergencies, you're putting food on the table, et cetera. And so we did want to also highlight that. And again, as this survey was done just at the start of some of the changes nationally, financially with inflation or the increase in prices for various commodities. So probably we are starting to capture some of that in our survey results. And that does relate to nutrition and physical activity because you want to be able to afford to buy fresh produce. And we do see in our county that 28% of the adults say it's very or somewhat difficult for them to buy fresh produce at a price that they can afford. And that was higher than found nationally, and it's still higher again in South County and Salinas. So now we're getting into the nutrition, physical activity areas of a health issue in the county. So let's look at recreation and fitness access. So although our adult population is doing a bit better than the US meeting physical activity guidelines overall, it's not the case for our teenagers. But as shown on this slide, we do have a lower number of recreation and fitness facilities per 100,000 population than in California or the United States. So again, some opportunities for how we develop access to physical fitness activities and resources. So those are just some of the data that's in the report as it relates to those top 4 health issues. Again, for the sake of time today, we aren't going to go into all the data. There is a lot there. We definitely encourage you to be going to look at the reports. We are going to do more presentations and distribute the reports around the county. Certainly, you can access them starting today on our collaborative website. I just put a slide shot there of it beside us, but we'll put the link in the chat. Also, I wanted to just stress that what we're hoping to do is, as we get out and start talking to various initiatives, making sure the report's in their hands, and working with the several collaboratives and initiatives that are out there to, as we also strategically work within our organizations and with the collaborative on identifying which of the strategies maybe that have been ongoing for several years to continue to uplift and reinforce, and or if there are any gaps that we may need to start filling with other strategies. And I think that I will not go into one of the strategies because certainly Ms. Macias will be able to speak to that next. I did want to say that it's just wonderful to be recognized by the United Way Monterey County for the Community Impact Award at their community breakfast just a few weeks ago. And just again, recognizing when communities come together and start shining a light on data, we can lift up the bright spots, and we can also look at where we have opportunities for working together. And so that's very exciting for the collaborative and for all the initiatives out there to have come together now with one CHNA going forward, and we'll be redoing or updating every 3 years and tracking progress as well. So here is the link, but we'll also put that in the chat. And as I mentioned, all of those reports should be available starting today, but now we'll hand it over to Ms. Macias.
Thank you very much, Krista, for a really great look at the details and the results. And I'm going to ask you to stop sharing your screen. There you go. Thanks very much. Because we want to bring Monica on to talk about her relationship with the survey. Monica took the survey, so we want to ask you, what prompted you to take the survey? How did that work out for you? And then you have benefited from some of the programs that relate to the key issues that have come up in this assessment.
Absolutely. Hi, good afternoon. To answer your first question, what prompted me to take the survey, I was very keen on wanting to share my experience, but also my thoughts about the coordination of the services regarding all aspects of my health. And, certainly the top 4 that were identified here, I was falling into those categories. So at my annual checkup almost 2 years ago, I was found to be pre-diabetic in that category. And so, of course, that shocked me. Diabetes does not run in my immediate family. So, but it was also a matter of saying, I don't have to go down that road. And so my doctor, we had a great conversation, and I was part of her wellness program. So that was, the kind of the kickoff of how she was able to connect me with all the different services. And so I was enrolled in the fresh produce prescription program, and that's going to the farmers market every Friday and getting access to the fresh produce there. Also the handouts, the recipes, the the biometric screenings as well. I was also connected to the diabetes prevention program, which was a series of online courses that were facilitated by a health coach, a certified health coach. And that was also really eye-opening and very much a spot to community build with others who were in my situation, and we all met through Zoom. But it was really a way to embed those ideas and really make them come to fruition at home for myself, and for actually, they had that ripple effect for our family as well. So I was able to make changes to eat better and talk about, how our health would improve, and my family make that choice as well. And then, being able to be more active and move and do daily walks. And so all of those things really, really helped me. And, I've been able to get out of that pre-diabetes category, and I'm still on the journey, but definitely it was a coordination where I had not experienced that before with health services. It was really very narrow scope. And this was very eye-opening, and I really appreciate that opportunity for the survey. And it really helped me to promote that idea, and then really just give you guys a kudos for that.
Monica, when you took the survey, you took kind of your health in your own hands. Were you surprised at what was available to help you? I think a lot of people think, well, I have this problem, but I'm not sure what I can do about it.
Absolutely. I was surprised, and on my own, I would not have been able to coordinate that. And so it was really my primary care physician being aware of her being able to connect me with those services. I did not know about the diabetes prevention program online course. I didn't know about fresh produce, prescription program, but, so really her prompting, even health services and mental health services, her prompting that coordination was key. And it was very enlightening for me. And then, I may have been able to talk about that with friends, with my walking group, with anybody who I get a chance, that there are so many services available. Get, in touch with your primary care physician and ask for, that wider scope and wider view of one's own health.
Congratulations, and congratulations on taking this great step, and you look happy and healthy. And so let me ask you one more question about the survey, because I know I took the survey and I found it very interesting to answer questions about things that I had not thought about. I just simply had not thought about. Did you find that same experience where it was educational just to take the survey?
Yeah, absolutely. In that aspect of wanting to share that the coordination was really a key component for the idea to work for me, right? All the pieces of the puzzle had to be there, but also I did find that in the questions that were asked, there were, I didn't know that existed, right? And it may be that, I wasn't, I didn't have that conversation with my physician about, what about this? But knowing that through those questions in the survey, now I can get an idea of, if I need to, I can ask about X, Y, or Z, and then, have that discussion and possibly get connected with those services as well.
Thanks so much, Monica, for sharing your story
Absolutely.
with us, and keep up the great work.
Thank you so much. Thanks for your help. Thank you for having me.
Welcome. And then last but certainly not least, we have our friend Katie Castagna from the United Way. Katie, can you tell us a little bit more about what other value the collaboration has done great work, and we have these great results, but now what?
Thank you, Maya, and good afternoon. I'm so excited to be here, and I loved hearing Monica's emphasis on the value of that coordination of services, and certainly that is of great value and priority for United Way and the services we provide, making sure people are connected to what is out there. What we do, we are not a health system, but I'm speaking for United Way and all of the community-based organizations that provide human services. We're sort of on that end of the spectrum related to the social determinants of health, providing supports and services related to housing and employment and education. And in order to do that, to design programs, to evaluate programs, and to raise money for programs, we need data that really reflects the needs of our community and the most current needs. In the past, we've been aware of multiple wonderful assessments that each of our health systems has done, but there have been multiple of them, and the idea of having them coordinated in this collaborative effort to have one master data set, if you will, makes so much sense. And the time and resources that took to put together one integrated set of information that really reflects the most current community needs is extremely valuable for our nonprofit services in utilizing that to make sure we are providing the best support we can, that we understand our community and its needs, and that I'm thinking of some of the graphs that Krista presented, showing, in high relief, the importance of disaggregating or separating out the different populations and their status related to the different indicators in this data. It helps us understand the disparate needs that there are. Averaging all of us up into one number doesn't really get to the point of who needs what and how do we get to them, whether it's geographically, demographically. And so the idea that all of our health systems have collaborated to provide this rich set of information is really valuable, and will set us up for collaboration on the implementation front as well. And for partners in the community beyond the health systems, it is an amazing framework, and I'm encouraging everybody to use this information. There's already on the website that has been put in the chat, we've posted a link to the full set of data, as well as a searchable portal that where you can drill down and have some interactive data sets. And so I would encourage folks, whether you are a policymaker, a consumer, a service provider, to get familiar with that data, and to also appreciate the great work of our health systems to come together for this purpose. And it's a great way to efficiently and proactively dig into serving the needs of our community.
Thank you very much, Katie. That's a great assessment, because you think here you have all this data, you have this tremendous amount of information. What do we do with it? In fact, I had a question that came in, what will come from the gathering of all this information? And I think you just hit the nail on the head. It's for everyone to use. But for others who are participating, what can each of you use this information for? Maybe are there some real life scenarios that you can imagine how this information could be used?
So if I may,
Please.
so one of the things that I think is remarkable and that really needs to be highlighted is that each of the health systems makes their priorities, and they go to the board and see what is important to the community that they serve. So yes, and then they keep on looking at, how did we do? What measurements have we achieved? How are we moving the needle forward? One of the things that is going to be happening forward, and Kathy hit a little bit on this is that the hospitals have decided to continue this work together. So that is something that we hope to be able to highlight going forward on how can we move the needle on some of the key items that we all could agree on. Maybe it might be diabetes, it might be something else, because the hospitals are more than just the four walls, they're part of the community. So don't have an answer completely for you just yet, but because we're just getting started on how collectively we could work on the health needs, along with the county and the nonprofits in the community. So I guess check back with us is the answer.
So this data gives you a chance to have a baseline, essentially, for how to benchmark yourself in the future.
Yes.
And then I'll add to it. As I mentioned, there are a variety of initiatives out there, really important ones in the county that are working on some of the areas already that were mentioned as some of the health issues. And so we'll certainly be getting the report out to everybody, but probably reaching out to, to the leads of some of those initiatives to also ensure that there's that linkage with strategies as they're developed across the hospitals. Would be probably in the next step. So for example, the Prescribe Safe initiative, which is already working in all the hospitals and the emergency departments, et cetera, would relate to the substance use indicators. And then how they proceed forward. As you say, we're tracking over time, the impacts we're having.
I have another question. How can the community learn more about the information, all this information that we've presented here today? How would you recommend people begin to look at this information?
Well, certainly there's the reports, which, 200 pages, wonderful reading in the morning or the evening. But also we're looking at how we can do some shorter infographics for them. Already, though, as Katie mentioned, there is that searchable online tool, and that's through the healthymontereycounty.org website. And you can look up and get a chart for a specific indicator.
And, I'm thinking about Monica's story. If you, maybe the 200 pages of reports are not your thing, but there could be things you're interested in, and look and see where you live and what are the indicators, and maybe take that information to your own healthcare provider and say, I'm hearing about this. This is what Monica did. And maybe that's something that we as individuals can do with this information.
Definitely about getting data into the hands of people. It can help them in their own empowerment journey. Yes.
All right. Thank you all very much for sharing this information. Congratulations on the successful work and for all the work that you're going to be doing now that you have all the data and what you're bringing to our community. I really appreciate you sharing all this with us today. And thanks everyone for joining us on the news briefing this week. Our next briefing is next week. We'll see you then.
Thank you so much.
Thank you.